Hi, my name is Corrine Harrison, and according to this MAR, we have a client by the name of Millie Larson who is due for her furosemide 20 milligrams via IV push every 12 hours to be administered over 2 minutes, flushed with 3 milliliters of normal saline before and after dose. It is to be given now for edema and blood pressure, and she has no known drug allergies. I also see here that her systolic blood pressure is over 120, which is a precaution we need to look out for when giving a patient furosemide, as it does affect her blood pressure directly. Okay, so now that we've gone over the order, let's go ahead and provide some hand hygiene and then get the supplies together. Okay, so we have a 10 milliliter pre-filled syringe of normal saline. The expiration date is 12/1/2022. Second pre-filled 10 milliliter syringe of normal saline. Expiration date is 12/1/2022, so those are not expired. We have alcohol wipes, tape, pen, gauze. We have a 23 gauge 1-inch needle. Expiration date is 1/31/2026, so that is not expired. We have gloves. We have the medication. I'm just going to refer back to her MAR. Furosemide 20 milligrams. This vial is a multi-use dose or multi-use vial of furosemide. The total contents is 10 milliliters, which equals 100 milligrams. So when that breaks down, every milliliter has 10 milligrams of the furosemide in it. So referring back to the MAR, we need to provide our client, Millie Larson, with furosemide 20 milligrams. Therefore, we need to draw up not 1 milliliter, but 2 milliliters, which will equal 20 milligrams. And the expiration date on that is October 2029. So again, furosemide 20 milligrams IV push every 12 hours, administer over 2 minutes, flush with 3 milliliters of normal saline before and after each use, to be given now for edema and blood pressure. And here we have the furosemide 10 milliliters to 100 milligrams, which is equal to 10 milligrams for every milliliter. So we're going to draw up 2 milliliters of this furosemide in order to provide our client with 20 milligrams as ordered. And here's the syringe, which will provide us with the 2 milliliters that we need to obtain from that vial. Okay, so now that I've gotten everything together, I'm going to go ahead and perform some more hand hygiene, and then we're going to start preparing the syringes. Okay, we're going to open up the first vial, or the first normal saline syringe, and it's pre-filled with 10 milliliters of normal saline. We're going to pull back on the plunger, break the seal, and we're going to go ahead and expel 7 milliliters of that normal saline, as we only need to give our client 3 milliliters of a flush. We're going to make sure no air is there, which it is not. I'm going to open up our second normal saline pre-filled syringe. Total is 10 in there, so we're going to waste 7 milliliters, leaving us with 3 milliliters of normal saline. Okay, we have our syringe. We're going to take that out of the vial. Then we're going to open up our needle, and without touching either end, I'm going to screw that needle onto the syringe. Dispose of that covering. I'm going to use the alcohol wipe. Obtain the vial of the furosemide. Again, 10 milligrams for every milliliter. And according to the MAR, we need 20 milligrams of this. So we need to obtain 2 milliliters of fluid. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I'm going to uncap the needle, place it over by the syringe box, put it into the middle, keeping it under the line of fluid, and then we're going to go ahead and aspirate 2 milliliters of this medication because 2 milliliters is equal to 20 milligrams of the furosemide. We're going to do the scoop method, and then we need to label our syringe. Furosemide, 2 milliliters, 20 milligrams. We need to label that onto our syringe since it no longer has a label on it. Okay. So now I'm going to enter the room with Miss Millie Larson. Hello, Mrs. Larson. I'm going to provide you with some privacy. Close the curtain. Now I'm going to provide myself with hand hygiene. Miss Millie, can I ID or verify your identification by using your name bands? Yes. Okay, so we're going to compare her name band to what's listed on her medical record. Millie Larson, date of birth is 1/1/1936, date of birth is 1/1/1936. Medical record 123-456, medical record 123-456. No known drug allergies is listed both on her name band as well as on her medical record. So, Miss Larson, the doctor has ordered for you furosemide 20 milligrams via IV push. You're to be given it every 12 hours. I'm going to give it over a period of 2 minutes after first flushing you with the normal saline, and then I'm going to flush you again afterwards. Do you have any questions? No. And by the way, this is for your edema as well as your blood pressure. We also noted that your blood pressure was safe enough for you to receive this medication. All right, so now that that's done, I'm going to go ahead and provide myself with more hand hygiene. I'm going to place my gloves on. Before we start, we are going to assess Miss Millie Larson's IV site or an insertion site. Miss Millie, does this hurt here? No. Okay, so she has no pain, no redness, no swelling, and no drainage present to that site. So that is good for use as far as we could see. I'm going to take an alcohol wipe and scrub the hub of the IV line. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Getting the first syringe of normal saline, which contains 3 milliliters as ordered. We're going to go ahead, attach it, open her line, and initially we're going to aspirate to check for patency with the visualization of blood, which we have. Then I'm going to slowly flush her line with the 3 milliliters of normal saline. And that's completed. I'm going to go ahead and dispose of that syringe. Again, we're going to scrub the hub. 5, 6, 7, 8, 9, 10. Then we're going to obtain our syringe. We're going to take off the needle, dispose of that in the sharps container. We're going to connect that to her IV line, and then over a period of 2 minutes, we're going to slowly dispense this medication through her IV line. Over this period, I'm also going to watch our client for any changes in her mentation while I'm administering this medication, as it could be a sign of a reaction. Okay, once all the medication is expelled from the syringe, we're going to unattach it. Screw lightly, dispose of that syringe. And again, we're going to provide an alcohol wipe to clean the hub. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Then we're going to provide that line with another flush of 3 milliliters of normal saline. Okay, while that's attached, I'm going to go ahead and place her lock back on, unattach the syringe, dispose of it. Then we're going to check the site. Do you have any pain here? No. Okay. There's no swelling, no pain, no redness, no drainage. And it is warm to touch. Okay. I'm take off my gloves, provide myself for more hand hygiene. Now we're going to document. Thank you.